Okay, we're here in University Hospital in Galway and I'm with Dr. Martin Cormack, and when we talk about antibiotic resistance, it often feels like it's far away. And I suppose what we're going to do now is we're about to enter the room of a patient who's actually been dealing with the issue of antibiotic resistance. And I suppose it's good to hear the human stories, because it affects other humans, it could affect me, it could affect anybody, isn't it?
Oh yeah, yes, it affects lots of people, and it's a very common thing for us to have to deal with now. And Cathie will tell you her story. So what started off with what would have been a very simple bladder infection, which in the past you would have expected to get better very quickly on one of the ordinary antibiotics that the GP gave her. And as she will tell you, the ordinary antibiotics didn't work. The infection got worse and she ended up being in hospital for quite a while to get IV antibiotics to treat an infection that in the past we would have expected not to get anything like so serious. But so just before we go in, we'll just put on this apron. So this is just a plastic apron, and what it does is it keeps bugs off our clothes, so that when we leave the patient's room we take off the apron. And it does mean that if we picked up any bugs in the front of the apron, we're leaving the bugs behind us.
And I think that's an important message for people as well. And it mightn't seem, all of us have to go to hospitals, unfortunately, from time to time, and it might be visiting people or anything. And what we're doing with our hand hygiene there is stopping the spread is really, really important. That's why that message is so important. And we had a discussion before I met you this morning. We were talking about a grandmother of mine who when she went to hospital, she could visit 10 or 12 people, and that idea of seeing anyone that was there. But it's very important if we're going to hospitals, it's a high risk area, isn't it, Mark?
Hospitals are high risk areas, and bugs that are very harmless to the rest of us, bugs that are good for us most of the time, the bugs in our gut, can cause problems for us, particularly if they're antibiotic resistant. When we're in hospital and we're very vulnerable. So it's probably best to just visit the person you came to see, and also best to be careful about hand hygiene coming into the hospital, and the gels now are usually in the hospital lobby for people to use. And then the key thing is just to follow the advice of the hospital staff. If they ask you to do something, there's usually a good reason why they're asking you to do that, to help to stop the spread of bugs. And hospitals are very different places, and we do need to be extra careful in them.
Okay, let's go in here and Cathys Story.
Hi, Cathie, Martin Cormack, and we met earlier, and you said that you would be okay if I brought Tommy from the Farmers Journal along, and that you might tell him your story about what happened to you, and about the infection you had and the superbug and how that affected you. Is that okay?
That's grand. So I just tell the story, yeah?
Yeah, just what happened to you. Yeah.
I suppose it was about a week and a half ago. I came down with cystitis, and I'd had it a few times before, so I kind of knew what it was. It was like just kind of an urgency to go to the loo, and sort of a burning sensation when it happened. So I knew what it was. That was the Monday. The next morning I just went into my GP, and she agreed with me. She said it's probably cystitis. And she said the usual, drink lots of water, and she gave me an antibiotic. And this was an antibiotic I'd gotten a few times before in the past, worked fine. So it was Tuesday, and then Friday came, the week went on, and I really wasn't feeling any better. So I just rang the GP, and she said, look, come in, do a urine sample, drop it into us. And I did that, and she then swapped me to a different antibiotic.
Right.
And that was grand. Still wasn't getting any better. Sunday came and I was very bad. I was feeling really washed out, very lethargic, and I had a pain on my left side, kind of at the back, kind of beside myself. I was kind of shivering, and it wasn't a cold night,
Had you ever anything like that before, Cathie?
Nothing like this, so it was kind of unusual. I said to my husband, John, maybe we should ring Weststock. He rang Weststock and he told them about the pain in the back and whatever, and they said go in now to the emergency department. So then we were in, and that was nearly into Sunday evening, and when I was in, they thought that maybe the infection had spread into my kidney,
right, yeah.
And possibly the blood. So they took a load of blood tests from me, put me up to the ICU nearly immediately. I was very weak, I could hardly walk, and they put me on an intravenous, an IV antibiotic. Yeah. I was there a few hours, and they were checking me all the time, and then they came back into me and they said that the urine sample from Friday had come back, right, and there was some kind of a superbug in my system. and they said this bug is resistant to antibiotics. So whatever I was on in the drip originally wasn't working at all.
Right, yeah.
So they changed that out, and I was up there then, and I didn't sleep at all. They were monitoring me all the time. Everything was beeping, and it was Monday night, 24 hours really only started. It took me that long to for really to go. I was just really restless. Tuesday then came back down to the wards, and I said, look, can I take antibiotics and go home? Can you give me a tablet? Because I just wanted to go home. And they said, no, you need to be on this drip antibiotic for at least another week.
And did they explain to you, Cathy, why you need to stay in the hospital and have the IV antibiotic?
Yeah, so apparently the tablet antibiotic, this superbug, I asked about that and I found out a lot about the superbug. So it's an ESBL is the name of it. And I'm not sure exactly what that stands for, but ESBL, and it's resistant to the first antibiotic I got, the second one from the doctor, the third one, even the drip one, and the fourth one apparently is the one that's working. But it's resistant to about 5 different types of antibiotic. So I had to be on the drip for a week. And I was, when you hear superbug, you kind of go, oh, that's a hospital, something in a hospital that you get. But the last time I was in the hospital for any length of time was with my youngest child, like 15 years ago.
Right, yeah.
So I didn't know, I was, but apparently with this bug, it can show up in water, it can show up in animals. So I was very surprised, that whole thing.
Yeah, and did you find all of the sort of the precautions, like us wearing aprons and that, did that bother, did that bother you? Did that make you feel scared, or did people explain to you what that was about?
No, I mean, people were very good. I was kind of like, God, what have I got, but it's with the superbug, they said they have to be just very careful with contamination and cross-contamination. I didn't realise that it's so easy to get, in the right circumstances. It's not a very unusual thing. It's cropping up in a lot of places.
And of course we've talked to you about that, while all of these precautions we have to take in hospital are really important about protecting the bug getting to other people, that when you go home, you live your life as normally. So the fact that you have a superbug doesn't impact on your normal life. When you go home, you go back, you may carry this bug. You remember we talked about, you might carry this bug in your gut for a long time, even though you're better from the infection. But that doesn't need to interfere with your ordinary life. But in the hospital, we just have to be that a bit extra careful, because the person in the next room might have just gone cancer treatment and they might be particularly vulnerable.
Exactly. No, I'm lucky, and it's great that they caught it, because they wouldn't have caught it if that urine sample, the bloods take a few days, so when the urine sample came back, they're lucky they caught it,
Okay, well, thanks very much for telling us the story. Is there anything you want to ask me about it before I go, or and I can come back to see you later if you have any other questions?
No, you explained a lot to me, so that's great. So I hope that's useful to you.
Thanks, Cathy. I think it's very important just to put a face to a thing we've been talking about for a long time, and just for people to understand that it can affect everybody.
Yeah.
Not just your farm animals, but it's yourself and it's all of us. So thanks for your time.
Yeah.
Thanks very much.
Thank you.
I suppose, Martin, what's real about that situation, and we're lucky to have heard it, is, a lot of these times, problems seem far away, and that's a real person's story. And, when they talk about urinary tract infections, that's something that can affect all of us, isn't it?
Yeah, and as you said, this is a reality of what antibiotic resistance has become now, is that some of the antibiotic resistant bugs that 20 years ago, when I started in this, were actually really uncommon, like the bug that Cathy told us about there, ESBL. So 25 years ago, ESBL was a very rare antibiotic resistant organism that we only saw in people who had long and complex hospitalizations. And in the last 25 years, it's escaped out into the community, so that even people like Cathy, who are in good general health, now can pick up this bug. And if they're unlucky enough that bug causes them to get a bladder infection that spreads to the kidney, it becomes a very dangerous illness. And of course, we still do have antibiotics for ESBLs, and that's good. But for some of the antibiotic resistant problems that we're starting to see in hospitals now, in particular, the big one we're worried about at the moment is one called CPE. And even the antibiotic that Cathy's on now won't work for CPEs. Their options for treating CPEs are even less so. So we're already in a place where antibiotic resistance is a problem. It can get worse. But again, the important thing is there are things we can do to slow this down. There are things we can do to make this better. And the key thing is that for all of us, whether it's on the farm or in the hospital or in the surgery, that we all think more about using antibiotics and use them only in the situation, and hygiene, and antibiotics only when we need them. And one of the really important things about antibiotics is that most of the bugs that live in and on your body are of course good for you most of the time. So if you don't have an infection that needs an antibiotic, taking an antibiotic is probably going to do you more harm than good. So only when you need them is good for you, and it's good for making antibiotic resistance less of a problem.
As much as necessary and as little as possible.
Exactly, yes. Yeah.
Okay, thanks Martin.
Okay, thank you very much.
So One Health, you've heard some profound messages there, and I mean I've very little to add, bar I'm a vet and I'm standing in a hospital situation, and it really is that link between animals, human and the environment. It's about antibiotic resistance, it's about how it affects you, it affects me, it affects everybody, and the actions we can take to make such a difference. And this is what this campaign was all about. It was raising awareness and letting people know that there is things we can do, but it is a serious problem, and that is the challenge of antibiotic resistance and the One Health message.